So typical treatment for sciatica, low back pain would be to address any sacroiliac issues. So that's an injection right into this joint, so you might be able to see it better from this side. So we go right in here, and that's to bathe the ligaments as well as the nerves to simulate a healing response, to make sure that we're addressing any structural issues and decreasing inflammation and increasing oxygenation of the tissue. For a herniated disc, we'll identify through either MRI or CT what level the disc is herniated and what level the spinal root is being compressed, and then we'll go right down into that area and put a little medication and reduce the inflammation. Interestingly, you can have, like I said before, you can have a herniated disc without symptoms. So as long as this nerve is able to move freely with movement, then it'll remain relatively happy. But as soon as it's pushed on, if there's pressure on it, and this foramina right here, this little hole where this nerve comes out, this is called the foramina, and you'll see this on an MRI. It's called foraminal narrowing, where this hole gets narrow, or because you'll lose disc height and this nerve will swell. So this little hole, what we try to do is we try to reduce the size of this nerve. We just try to take the inflammation out of the nerve, and the nerve actually shrinks down. And so we get the nerve to come back down to a normal size, which makes the hole a lot larger when the nerve is smaller. But we also like to restore the disc height. And this is done through proper hydration of the body, taking in plenty of electrolytes, and in sort of getting your body moving correctly again. Some people will like to do decompression exercises, so they'll hang upside down. So, they'll hang upside down like this, and they'll take pressure off the spine, they'll take pressure off the disc. So that can help rehydrate discs. There's also the McKenzies, if anybody's heard about McKenzies. Those are really helpful. But like I said, we'll go down and we'll treat the nerve root, reduce the swelling, and hopefully increase this disc space to take the pressure off the nerve. And that's what was done in my case. So in my disc herniation, it was L5. And so what was done is I had an injection around the nerve root and around the disc, and it really changed my symptoms. Within one treatment, I could tell my symptoms were really different. My pain didn't go away right away, but my symptoms changed. It was a different sort of pain. The quality of pain was different. So I knew that something was working. And so I stuck with it, and 7 to 8 treatments later, I was feeling much better. So it's a pretty simple procedure. People don't have to, take a lot of time down. I recommend that people don't take a bunch of antioxidants before the treatment, especially if I'm going to use ozone, because ozone is an oxidative stress, and I don't want to negate any of the medication, the effects of the oxidation. So, high dose antioxidants are not recommended. Not taking any ibuprofen or anti-inflammatories is recommended. I like to apply heat to the tissue, and the reason I like to apply heat is because I like to improve blood flow. Like I said before, these tissues have very poor circulation. The ligaments, the tendons, they don't get a lot of blood. So if I can improve the blood flow, I'm doing something, right? Because I'm oxygenating the tissue that hasn't been oxygenated or that is poorly oxygenated, so I can actually speed up the healing process in the body. So I avoid ice. So if there's an injury, I don't ice anything. The body naturally wants to increase circulation, and it sort of brings heat into the area. And I like that. I want to mimic nature. I want to take advantage of the systems that are already in place, so that we can get a good, swift healing response.